Hello, I'm Dr. Rakesh Kumar Prasad. I'm an endocrinologist. Endocrinology pertains to all the hormonal disorders. Today I'll discuss about diabetes, especially emphasizing on how to know whether you are at risk of having diabetes or not. We have a good scoring system to predict the risk of you having diabetes later in your life. This scoring system is a composite of 10 different points, and a final score determines whether you'll develop diabetes over a period of time or not. The first and the most important point is what is your age. It is stratified in different age groups, but in short, it tells that higher the age, the chances of having diabetes is higher later in your life. Second important point is what is your gender. Being male means you are at high risk of developing diabetes later in your life. Third point in the scoring system is what is your blood pressure, or have you ever taken medications for blood pressure? If the answer is yes, probability of developing diabetes later on is much high. The fourth important point is whether you have a family member who's being affected with diabetes. If the answer is yes, the chances of having diabetes later on is much high. Also taken into consideration is the ethnicity. Ethnicity implying which part of the world you are from. There are certain parts of the world, if you are from belonging to that part of world, the chances of developing diabetes is much higher. The sixth important point, which is that whether have you ever been diagnosed with high blood sugars in a routine examination, or for females, if during their pregnancy have they ever had been diagnosed with high blood sugar? The chance, if the answer is yes, the chances of having diabetes later on in their life is very high. The seventh important point is whether the person smokes or not. Smoking per se is a very important factor, not only in determining different cancers and things like that, but also in determining whether you will develop diabetes in later half of your life or not. The eighth important point in the scoring system is how often you eat vegetables and fruit. If the chances is very frequent and very often, the chances of developing diabetes is very low later in your life. And ninth important point is how well you exercise each week. If the answer to this question is minimum of 30 minutes per day for 5 days a week, the chances of developing diabetes later on is very low. And the last and important point is what is your waist circumference. Waist circumference, to make it simpler for you, is measurement of abdominal circumference at around the navel level. Technically speaking, it is the lowest point of the ribs and the highest point of the hip bone. The center of it is taken as the middle point, and circumference at that point determines what is the waist circumference. If the waist circumference is high, the chances of having diabetes later on is very high. With this message, I hope it'll help you determine what as per individual you have your chances of having diabetes later on in your life. Thank you.